Good afternoon. My name is Daniel Bulek. I am a D&P candidate with the Maryville University of St. Louis. And I'm going to be discussing my D&P project that was a brief, app-guided mindfulness-based stress reduction in undergraduate nursing students. So the project came about initially with identifying this need for stress reduction interventions, and this came from working with students both as an instructor and as a psychiatric mental health nurse practitioner student, and realizing that there was this increased prevalence and increased severity of this perceived stress. And thereby I was looking for something that would help to reduce that stress. And in particular, I identified this cohort of undergraduate nursing students, and seeing that there was high stress within this highly structured academic setting, and that there was a need for some sort of a modality, some sort of technique, some sort of intervention to reduce this perceived stress. And beyond that, I was looking for something that would be with low barriers to implementation, something that is easy for students, easy for providers, easy for instructors, easy for mental health specialists to utilize, something that didn't require a lot of heavy lifting before they're able to use it. And in that way, also looking for something that was easily deployable, something that could really be easily used by these providers in a way that didn't require previous training or background knowledge or specialty skills. And yet something that was high yield. So that was the beginning of the search for some sort of intervention that would be able to provide high yield, easily deployable, low barrier stress reduction within this cohort of undergraduate nursing students. And so what we came to was this finding of mindfulness-based stress reduction. And there are various modalities used across various settings, various populations. There was significant in studies found within military settings, so high stress cohorts that were able to find significant reduction in stress, as well as these kind of secondary benefits of increased performance. And then I was trying to think, is there a way to make this, again, something that's easily deployable with low barriers? And so investigated, could we try a one-time intervention, something that doesn't have to be done repeated or over time, but just once? And does it have enough effect on reducing perceived stress? And beyond that, we tried to find something that was brief. And so I settled down on just a 2-minute mindfulness practice, something that would be easy to fit in the schedule, easy to fit in the curriculum, easy to fit in within a classroom. And so trying to find something that was without this heavy lift initially. And so looking at a one-time intervention, something that was brief, we were able to settle on 2 minutes. And again, it was mindfulness-based. And so it's something that brings tools that they already have, that they just have to alter their perception or alter their attention in a way, but not that they necessarily have to go find a different tool or a different substance or a different activity, that they are able to leverage this just by altering the way that they think or the way that they focus their attention. And then we tried to find something that was with easy implementation, like we said, that was easily deployable. And so the idea of it being app-guided, something that instead of having to have an instructor or instead of having to read, that you can open something up easily accessible within most of our reaches within some sort of a cell phone, and that there is free apps. In particular, we settled with the Insight Timer that provide a quick, easy tool to guide this mindfulness practice, so that there doesn't have to be particular training or specialty education beforehand. And then I investigated if this would be effective during class. So instead of having to make this an outside practice or something, could this be something that is easily integrated into the class time, and can it be used within that class to reduce those perceived stress levels? And so considering high stress events such as, a presentation or a exam, is this a tool that we can use and deploy within the classroom to help students succeed by reducing their perceived stress? So our intervention landed on, in summary, a one-time brief 2-minute mindfulness-based practice that was app-guided that we implemented during a class time to then see if it would reduce stress. And the way we measured stress was perceived stress. And in particular, I found the perceived stress scale that is highly effective at evaluating stress levels within the perceptivity of the participants. And so it made a easily identifiable change in how they perceive their stress. And we were able to measure this with a pre- and post-test anonymous surveys. And so these were surveys that didn't collect additional information, and instead in aggregate we were able to evaluate what is the pre-intervention, the pre-test perceived stress levels, and then we implemented the intervention. The participants practiced within this 2 minutes on that one time their mindfulness practice through the app, and then we evaluated a post-test anonymous survey as well to see is there a difference before and then after implementation. We were able to implement this across almost 150 undergraduate students. These were particularly junior level students, so third year level students within a 4-year institution, a university here in the Pacific Northwest. And we were able to implement it during a class that was randomly selected to not have a particular bias. And then we're able to implement the pre-test survey, implement the actual intervention within the classroom that was standardized across all classrooms for the 150-ish students, and then collect our post-test anonymous surveys after that. What we found was that there was indeed a reduction in perceived stress. So our average pre-test scores on this perceived stress scale was 20.94, and we were able to reduce it after intervention on our post-test anonymous survey to 19.44, which is pretty significant within that stress scale of a reduction. Beyond that, what we found was that it is indeed statistically significant of a reduction in perceived stress. We were able to collect 112 of our participants' survey responses on both the pre-test and the post-test. And it found through statistical interpretation with the paired samples t-test to produce 4.81, which is statistically significant, and our p-value was below our level of significance. And so it is found that it is not an anomaly in this finding, but that it was indeed correlated with the intervention. We found a moderate effect size with our Cohen's d of 0.45, which shows that even a brief 2-minute mindfulness-based stress reduction activity practice can reduce stress pretty quickly and significantly with that. So we didn't find that there was effective reduction in perceived stress, and it was this one-time app-guided 2-minute mindfulness practice that was able to reduce that stress. And again, this is among undergraduate nursing students. And it was during class. And so these were particular perspectives that I was investigating to see if we could find a effective modality, and this proved to be a promising one at the moment. Future studies that look at some of the limitations of the study, there was not a control group in our practice. So we included all of the students that so chose to fill out the survey among the entire junior level seminar courses here. And out of that, the pre and post test did show that it was effective, but again, it's hard to extrapolate what specifically could have led to this stress reduction in isolation, since there is no control group. And so something to investigate in the future would be to look at a control to see if we can thereby better isolate a direct correlation and thereby try to infer a better effect with this brief mindfulness-based app-guided stress reduction practice in these students. And as well, as we mentioned, this was only among our undergraduate nursing students, and so it would be interesting to investigate if there are different populations and how this would be able to be transferred to different students in particular, and different degrees or pathways of study, and then as well to then look at potentially investigating the effectiveness of this intervention across grades and across levels of schooling. So investigating, is this effective in class in high school, middle school, elementary school, to see if there are additional uses for this implementation, and also if this is an effective tool across the diversity of human experience. And then additionally to explore more long-term effects. So this investigated just a more time-limited effect of the perceived stress, and so with just 2 minutes and then having a post-test after the fact later on, it did show a reduction in perceived stress, but then to evaluate, does it sustain, and thereby kind of brings up these questions of, is there utility to longer practices that are not just as brief or 2 minutes, and practices that are more sustained? So having kind of a daily practice, or 3 times a week or something, and to investigate whether these practices are just as effective, more effective, or less effective than just the 2-minute mindfulness practice. And then additionally, looking at implementation. So we do find this intervention is useful for immediate stress reduction. And so thinking about how can this be integrated into teaching and curriculum, here within the site of implementation, we're looking at producing a brief white paper to share our findings with other faculty, other instructors, other members of the student support team, to see if we can leverage these findings in a way to better optimize student support. And so can we integrate these brief mindfulness practices within the curriculum and teach the usefulness of mindfulness, teach the usefulness of stress management to our students in a way that is more explicit? So can we equip our students with these kind of metacognitive skills to manage their stress in a way to thereby support their well-being, but also their performance within school and within practice? In particular, it is useful, it seems, given its kind of time-limited stress reduction, to consider this and integrate this intervention before high-stress events such as a presentation or exams. And that if we were to continue investigating and to pull forward some of the research that was found in these other high-stress cohorts, that there's even suggestions that mindfulness-based stress reduction strategies not only help to reduce stress, in particular perceived stress, but also help to optimize performance and results on that. And so contemplating ways to implement this intervention before these high-stress events, such as presentations within our undergraduate nursing program here, or exams, and in particular as we prepare them for their practice entry exam with the NCLEX, that can we equip them with these skills both at a metacognitive level to kind of manage themselves, but also within the events and the high stress events that we want them to perform well within our own curriculum. And then there's also the opportunity to implement this across clinical practice and integrate it into the clinical practice. In particular, among the undergraduate nursing program here, how do we incorporate this within their clinical practices, their clinicals, their internships, to see can they better manage these entry kind of skills, these entry events that can be high stress. And so thinking about, how can we integrate this before they go into a shift? And so equipping clinical instructors to maybe guide or make space for a brief mindfulness-based practice before they start, their first shifts, to help kind of regulate their stress levels and to help kind of mitigate some of that stress-related performance impairment. And then looking as well at how do we equip them with more discrete and kind of these easily accessible tools before new skills or before kind of new stressful activity that they have to engage in. And so as students go and learn how to perform a physical exam or to perform a particular procedure or to interact within a particular setting, how can we equip them with a brief and yet effective intervention to kind of knock their stress down and to thereby strengthen them and equip them to be able to enter that next step more effectively. And so part of that illuminates or kind of highlights this opportunity for the usefulness of these brief app-guided mindfulness-based practices that a student can take a pause, either go find a place for 2 minutes or even just at the nurse's station, and to engage in these brief mindfulness-based practices in a way that can be easily integrated into their shift, easily integrated into their routines in a way that helps them to perform better. And then as well, looking at kind of after stressful events. And so after they go perform a particular skill or go engage in a new interaction or within a new setting, or even to the more significant kind of high stress situations with a deteriorating client or a client that passes, kind of these transitional events that might increase their stress. There's opportunity for useful mitigating of their stress, a useful reduction of their stress, again, with something that can be easily integrated. And so the brevity of this mindfulness-based practice, and yet showing that it is effective for kind of that more immediate regulation of stress, highlights the usefulness for this practice within kind of entry-level regulating of stress among our nursing students. And so at large, what this highlighted was that there is an effective, brief, app-guided, mindfulness-based practice that is effective at mitigating and at reducing stress among our undergraduate nursing students. And as anecdotally, stress and kind of the dysregulation of anxiety and stress appears to be more outstanding among our cohorts of students coming in, we're able to find alternative creative solutions to help equip our students to better manage that for themselves and thereby be able to better perform both academically and eventually as they enter the profession of nursing. And as stress is not going to go away, and as stressful events and stressors are not going to dissipate within the field, as providers and as educators, there's an opportunity to integrate the brief app-guided mindfulness-based stress reduction among students and among our curriculum, among our teaching in our class, and even in our clinical practice settings, so that students can learn how to then be effective independent nurses once they're not in our care or not within our educational institutions. And that it takes just 2 minutes to be able to reduce stress in a very tangible way.